Hey y'all, welcome to the Dunn Wisdom Show. I am your host, Melissa P. Dunn, public servant, award-winning entrepreneur, and personal brand strategist. Now, each week I love sitting down with change makers, trailblazers, and leaders who embody courage, integrity, and wisdom in action. And today's guest is one of my favorite people. We used to work together back in the day at Florida Medical Center. And, now we're still working together, doing work in the community. She is none other than Miss Constance Armstrong, Director of Outreach at Banyan Community Health Centers. Hey, Constance.
Hello. Thank you for having me.
Thank you for being on the show today. Girl, you are doing the thing.
We're trying out there. There's a lot.
There's a lot. So tell me, how did you get into healthcare? What's your journey been like?
You know, it's funny when you talk about journeys and what influences you, and you hear, you listen to people talk about having a plan. Mm-hmm. It's almost like I never had a plan.
Really?
There were just things that happened in my life that pushed me in a direction. When I was growing up, my mother had lupus, and I grew up with that. It was always like I had, this little brother over there. And when I was a child, I wanted to cure lupus. Wow. So that was my very first, career goal. So as time went on, when I was in school, I was a really good writer and communicator. And so those teachers say, you'd be a great writer. So I thought, okay, I'm going to write. So I chose my college because my cousin was a basketball player at USC in California. So I thought, oh yeah, that's a great, school, I'll go there. And they have a journalism program. So I did that. And while I was there, I met someone in music, which I had never planned on going into. And because of that person, I ended up being in music for 15 years.
Wait. Slow down, girl. I did not know that. You worked in the music industry?
15 years, yes.
Doing what?
So I worked for Jive Records. I worked for Uptown Records. I worked for Epic Records. I was in A&R. That's the department that finds the talent. I was an A&R administrator, helping with production. I was in New York for several years. That's where I was with Jive, Kool Moe Dee, Uptown, which is Heavy D, Mary J. Blige, Jodeci. Epic, Luther Vandross, Shabba. And then I ended up going to Atlanta with LA and Babyface and worked for their production company and for their record company, LaFace. And of course, that's Toni Braxton. That's, a lot of soundtracks, Boys to Men. It was a very exciting time. And I was touring, doing lots of things. And then my mother passed away.
Wow.
And so, when you have those kind of things happen, you you become very insightful and start thinking about your life and what's important. And I thought, and thinking about the lupus and what she went through. And I thought, I really would like to do something that helps people. So I went and I thought about music and I thought about, well, what is it that I loved? And I knew I loved the whole project aspect of it.
Okay.
So I decided to go into healthcare marketing. And I started off at Grady Health System, which is a large healthcare
in Atlanta.
Yes. Which is like the Jackson.
Yes,
Exactly.
I toured Grady when working on a project just recently. Yeah.
Yes. And so I had a strong skill set. I started off at their children's hospital, but then I ended up being over the marketing for the health system, working very closely with the vice president of communications there. And I was there for 4 years. It was wonderful. And then my father had to go on dialysis. And he lived in Florida.
He lived here in Lauderhill, right?
Yes. He lives in Lauderhill, lived in Lauderhill. And so I quit my job and I came to Florida and started my career path. And I started off at a laboratory doing marketing, and then I moved to Tenet Health System.
And that's where we met.
Where we met.
So it's so funny because it looks like every pivot that you made in your career was punctuated by loss.
Yes.
Yeah.
Yes.
Wow.
Yes. And, I worked for Tenet Florida Physicians, and they had 200 physicians, and we did marketing, and we worked with the hospitals very closely. So that was great. And then, of course, I moved on, and I had another loss. My father passed away. So at that point, my thought was, I loved marketing. I really loved marketing for healthcare, but I really wanted to get closer to the people, right? And so the opportunity, because I had taken a year and a half off after my father passed away.
I remember.
And so, yes. And so a good friend of mine, she was the vice president at Banyan Community Health Center, which used to be Banyan Health Systems. And she said, hey, we have a position. We need to do outreach in the community. We haven't been doing that. What do you think? And I said, yes, I'm very interested, and I love it. I feel like I finally found my niche. The fact that someone can contact me or contact the team I work with, and they need something, and we can make it happen. And I'm not talking about months, days. We can immediately make it happen. We have someone who has, Banyan Community Health. We do primary care, we do behavioral health, and we do drug abuse. So
addiction,
addiction, yes. And so someone contacts us, and we can immediately connect them with a psychiatrist. We can connect them with a therapist. And one of the great things is we have what's called an integrated system. So let's say someone comes in to see a primary care doctor. We have a specific screening that we do for mental health. And if the red flags go off, we have what we call our behavioral specialist that will come in and start talking to them and make sure they get that connection. Because, many times someone comes in for primary care and they don't get, they need behavioral health and they have to wait for a referral. But that's my journey. So that's where I am now.
So pivots punctuated by loss.
Yes.
And it kind of gets you back to what it sounds like you really wanted to do from you were younger.
Absolutely.
Because your calling was, listen,
Healthcare.
let me figure out a way how to cure lupus. So you knew your calling early, right? And then all of these other skill sets that you learned along the way, I think is really preparing you for the role that you're in now.
Exactly.
That's really, really powerful.
And I think that, I think everyone has a destiny.
100%.
And I think it's your decisions that determine how you get to that destiny. And so I just had all these influences, like you said, that took me right back to, helping and caring. And so when people ask me what I do, many times I don't remember my title or anything. I just go, I help people. And I love it.
Ah, man, that's why we get along so well. Because I remember when you and I were working together for Tenant, I was the marketing director for Florida Medical, and you were on the provider side.
Yes.
And really kind of figuring out, well, how can we make sure that we're promoting the doctors, promoting the hospital with the vision of ultimately helping people. Yes. That's so amazing. So how does it feel to be working in your purpose?
Well, I can tell you, I get great sleep at night. And maybe the one challenge is I work remotely, I'm out in the field, but at the end of the day, I'm home in front of my computers. And what happens is, so I get up and I walk my dog and I get to the computer at 7:30, 8 o'clock, and I don't leave the computer until like 4 o'clock. But it's okay because I love it. So,
well,
that's
listen,
how I know.
I'm gonna push back a little bit on that.
I know.
It's okay because you love it, and you should love it, and you should find energy and passion behind it. But you've got to take care of yourself too. You've got to create balance and space for your cup to be full, so that you can give from your overflow, girl. Because we need you.
Yes,
we need you.
And it's I've really been trying to work on those things. So I'll give you an example of one little thing. I've talked to my my organization and leadership. They gave me a stand-up desk because sitting at your desk for more
small changes.
Yes, that helps you. So I try to start my day with the stand-up, and then throughout the course of the day, going up and down. I set an alarm for like every 3 hours that I go up and take a walk, and it helps that I have a dog.
Yeah.
But you're right. You have to really focus on yourself because you could lose yourself, especially when you're in a position where you're helping people.
You get to focus on yourself.
Yes, I get to focus on myself.
You get to focus on yourself. All right. So I want to learn more about your leadership, your vision, and how you really hone in to community when we come right back. Stay tuned.
You never miss a cut. When the last time you get a checkup?
I used to avoid the doctor, didn't want to hear the bad news.
So you mean you avoid the doctor? You forgot the doctor, my brother? We teach our boys to take care of what matters. Show up, stay on top of things. But are we really showing them how it's done?
Visit myhealthpledge.org and take the pledge. Then go to the doctor and bring someone with you. No insurance? We can help. myhealthpledge.org lists free screenings in Lauderhill and in Overtown.
Peace begins in the heart. And grows with understanding. every shared story, and every act of kindness builds a stronger community. In every handshake, smile, and kind word,
Join our movement, Lauderhill. Text Peace 365 to 545454 and become a Lauderhill peacemaker. Pledge your commitment to co-creating a kinder, more peaceful Lauderhill. So we're back, and Constance has shared that she helps people. So you and I used to work together back in the day, and we're still working together now in our prospective roles. So I have the Lauderhill Health and Prosperity Partnership, which is a collaboration between business owners, providers, government, which clearly I'm a public servant, right? And we're working together to make the community healthier, safer, and more prosperous. And you, my dear, said yes when I asked you to be the chairperson of the Healthcare Access Subcouncil. Why did you say yes?
I didn't see how I could say no, quite honestly. We've been with you
Since
for what,
day
2
one.
years?
No,
2 years now, 3 years?
You were a founding member, were you not? When I first started LHPP in 2021, you were right there.
Holy smokes! Yes.
We've been together for 4 years doing this work.
And well, first of all, one thing when working with you, I know that something's going to happen. I know something's going to get done, and I know it's going to be impactful. So we always want, myself personally and Banyan Community Health, we want to be part of the folks in the community that are making big changes and doing great things. So we always want to align ourselves and give support. That was one reason. But also just looking at how it was handled from the beginning. I mean, we started off with a community needs assessment, right? Going out there and really, not guessing, not, just going out and really taking a look at the disparities, the social determinant of health issues, and being able to identify the pockets and the problems. So I really appreciated that, because data is king, right?
Data is king.
Data is king. And then honing in on each of those sections and coming up with all those initiatives, and all of you guys listening, go look at that Lauderhill Prosperity Partnership website, and you'll see all the fabulous programs. Lauderhill Shines, just so many things. And I just couldn't say no, because there was no way that we could stop doing what we were doing. Yeah. And, so I was very happy, and I'm excited. And the people that I'm talking to, bringing on board to be a part of this committee, are very excited about what we're planning on doing in the future.
And I think where the true alignment is that we both have the same vision, right? We help people.
Exactly.
And I know at Banyan, in your work that you do, you're very community focused. You're very people focused. And so for me, there's a lot of alignment there.
Yes, absolutely, absolutely. We love LHPP. We love the things that it's doing, and have big plans.
Yes.
For what we're going to do with that committee.
We're going to get it done. So, Constance, talk to me a little bit about your leadership. You lead a team now, and ever since I've known you, you've always been in some sort of leadership role, whether in your profession or in the community level, like the work that we're doing together. What are your core leadership principles that you follow every day?
I think some of the main things are, so with the team, transparency, having a just culture where everyone feels open to make recommendations, to acknowledge maybe mistakes they've made and putting them on the table to make improvements. That's really important.
Yeah.
Having an open door policy. But one of the biggest things as a leader that I find is that first thing is you can call yourself a leader, but if people don't choose to follow you, you just walking that path alone, girl. You know what I mean?
That's so true.
Right.
That's so true.
It's about really being engaged with your team, and also making sure that they have a stake in this, right? I really get my team involved with, so for example, if there's an issue or something that has to be done, I don't just tell them to do X. I explain the whole situation to them and make sure they're a part of the whole thing, because they feel good when at the end of the day they help patients as well. So I think it's important to make your team feel a true part of the solution, to make sure they know that they're making a difference and they can feel good about what they're doing. Even if it's someone who's just collecting data, letting them know at the end of the day, your data is helping this person so they can feel good. And I also believe in, so for example, when I do interviews for candidates, I have my whole team do the interview.
Okay,
And
because
we all-
you need to choose the right person to bring into your
Exactly.
culture and your dynamics.
Exactly.
Smart.
And if we have a person that needs to speak Creole, we have an outreach coordinator that speaks Creole, and she's going to have a conversation with that person to make sure that they, can speak as well as needed out in the community. And trust is a big thing.
Trust is a huge
Yes.
thing, especially now in the community where there's so much medical mistrust. How do you handle that?
I don't know if we're just blessed. The team that I have, or if it's the training we've been doing, they're really good at connecting. Because there are a lot of challenges right now, and a lot of people are staying away from clinics because of these challenges, and they're not sure where they can go and where safe space is. And so the good news is I feel my team is able to connect. And I think because they truly believe in what they're saying and they know that Banyan Health System, Banyan Community Health Center, again, we changed our name.
Just change your name, yep.
Is truly committed to help. They know the leadership is committed to helping folks. They know we're all committed. It's honesty in what they're saying, and I think our patients can feel it. And a lot of our patients, they connect so much. If they have a challenge within our system or in the healthcare system overall, they call and talk to the team. They cry with the team. The team cries with them. So I think they see the honesty there. And I think that's what's been, I think whenever we go out and talk to people and go to churches or in events, the patients, once we have a conversation, they're in,
So it's just being in the right room, having the right conversations.
Right,
And
with the right intention.
With the right intention, yeah. Intention is a lot.
Holy smokes, yes it is.
Intention is a lot. And I'm finding that even as a leader, as we roll out new initiatives, that the intention behind it is really almost like gas in the engine.
Exactly. I think that the intention brings in certain energies.
Yeah.
And positivity, and people can feel that and they want to be a part of it. Just like with LHPP, when we've had meetings, people were just, the energy in a room grows and everyone's more focused.
Yeah.
And I think intention in general is really important because when you talk about like with work, managing work, trying to keep that energy positive, right? Because all of that comes from the top, right? Keeping it positive. Like when I go outside and walk, I'm looking at the trees and I'm recognizing, wow, look at that green. I'm walking down the street and I'm like, wow, I feel this breeze. Ooh, it's going to rain because today, in 2 minutes, this minute's gone and it never comes back. So I think it's real important personally and with the patients and as an organization, we're intentionally going out, paying attention to what's going on and responding.
You know what you just said a while ago? I want to presence you to something. You just said that when you're out, you pay attention to the trees, you pay attention to the wind, and you're present. So I would submit to you that you have a mindfulness practice, and that's one of the ways that you're filling your cup. Yeah.
All right.
I will submit that to you. We'll be right back.
You never miss a cut. When the last time you get a checkup?
I used to avoid the doctor, didn't want to hear the bad news.
So you mean you avoid the doctor? You forgot the doctor, my brother? We teach our boys to take care of what matters. Show up, stay on top of things. But are we really showing them how it's done?
Visit myhealthpledge.org and take the pledge. Then go to the doctor and bring someone with you. No insurance? We can help. myhealthpledge.org lists free screenings in Lauderhill and in Overtown.
Peace begins in the heart. And grows with understanding. Every shared story and every act of kindness builds a stronger community. In every handshake, smile, and kind word.
Join our movement, Lauderhill. Text Peace 365 to 545454 and become a Lauderhill peacemaker. Pledge your commitment to co-creating a kinder, more peaceful Lauderhill.
So I'm having a great conversation with my friend Constance Armstrong from Banyan Community Health. And Constance, I am, as you know, really concerned about the state of healthcare in America right now. As we are filming this today, we're in the middle of a government shutdown. As we're filming this today, in my community, where we already have 11% of our population that's currently 15% of our population, which accounts to 11,000 people in my city, are currently uninsured, right? 24% are either on Medicaid or Medicare. This recently passed bill is gonna exacerbate what's already been a really growing health disparity chasm around access to healthcare. Like community health centers like yours, I think is an important part of that solution. What are you seeing in the community right now?
Well, people are nervous. They don't know what the future holds. They don't understand a lot of the things that are going on, and there's a lot of misunderstanding about what programs are going on and which programs are being canceled. But I can tell you this is a great opportunity for FQHCs, or let's not say a great opportunity, let's say this is
you guys are you're gonna get a chance to stand in the gap.
Correct.
For someone who may not be able to have a great, maybe their Obamacare premium is going up and they can't afford health care. In a way, you are a resource.
Exactly. So FQHCs have different types of funding. We have grant funding, which is some of the funding that, everyone's worried about, but we also have sliding scale. And sliding scale has always been there for what they call, I guess, the working poor, individuals maybe that are landscapers. They make enough money to take care of their family, but they don't have enough money to purchase insurance. And the sliding scales make it reasonable for them, where you could have, depending on your salary and where you fall, you could pay $3 for a prescription or $30 for a doctor's visit. So I think right now, as an FQHC, we need to get the communication out there, be a little, more aggressive. We're letting the communities know, there is a place for you to go. Don't feel like just because maybe some programs have happened or you've lost some options, we are an option that's always there. And so we're really trying to get that word out into the community, that all is not lost,
All is not lost, and even despite the potential raise in premium, despite the potential cut to Medicaid or Medicare, the fact is healthcare is still critical. We still want you to take yourself and your loved ones to the doctor every year to get an annual checkup, because prevention saves lives. And what we don't want is for people to stop going to the doctor, right? And so what I'm hearing you say is find out where your community health center is.
Yes.
Go and talk to them, because they might be able to give you a discount on the healthcare based on your income. Is that accurate?
Correct. I also want to add that if you have Medicaid and you're thinking your Medicaid has been canceled, or you should talk to your doctor and just have them check. Don't make any, because there are some people now that are thinking that maybe because of some of the cuts, they no longer have their Medicaid. Check with your physician. They will be able to tell you whether or not, you still have Medicaid and what to do to get it reinstated or reevaluated.
Yeah, so the bottom line, y'all, still you need to make sure that you access healthcare. And what is really making me stay up at night is the thought of someone who maybe have a chronic condition like diabetes or high blood pressure, and they hesitate making medical decisions because of access to care. I had a dear friend of mine who had breast cancer years ago, and even though at the time she was temping at one of the best cancer hospitals in New York, she was uninsured. And so she ended up delaying her treatment. And to this day, 25 years later, I really do believe that that delay is what caused her death. And so I'm really grateful for the work that you do at Banyan, and I'm excited for the work that we're doing together through LHPP, through this health council work, because we're going to be boots on the ground, making sure that we connect people to services.
Absolutely. Absolutely. And, you know, we're doing that as an FQHC, and we're being very aggressive to work with the insurance companies as well. I think they see the need and the gaps in the community that need to be filled as well. So, for example, like Sunshine Health, they have a mammogram that's going to be in Lauderhill in November. We're going to connect our patients, you know, work aggressively to make appointments for them to get to that mammogram so they can get those, you know, those mammograms taken care of.
I love
So
that.
it's a team effort.
I love that. Team LHPP. Let's get it done.
Absolutely.
So what is your final words for wisdom for members of the community? And I really am going to ask a two-part question. Part one is a woman who is thinking about her own career journey to finding purpose. What would your word of wisdom be for that woman?
For that woman, I would say, look at what you would do even if you weren't getting paid, right? I would do what I'm doing even if I wasn't getting paid.
Love that.
I think that's the main thing, because the difference between a job and a career is the passion. You know, it's funny, my godson, for a long time, all through his life, he was always running after the money. Oh, I'm going to sell cars, I'm going to do this. But now he wants to join the fire academy, and it's a passion for him. And now, you know, he wasn't following through with things before, but now this is something he loves so much. On his free time, he's studying, he's taking classes, he's doing this. What is it that you would do even if you weren't getting paid?
That's it. Powerful conversation, Constance. Thank you for joining.
Thank you for having me. This is great.
All right, guys, join us for the next episode of the Dunn Wisdom Show. And in the meantime, I really would like for you to take really good care of yourself. Make sure that you're checking on those you love, and make sure that you are making space to go to the doctor. Be well, everyone. See you next time.